We may soon have a regional COVID-19 response plan for eastern Idaho. Local News 8 reporter Andrew Howe is at the Eastern Idaho Public Health offices right now live where that plan is being drafted. Andrew.
Yes, Todd. In fact, a draft of that plan is now available to the public following a meeting by the health board that took place yesterday morning.
Early on in the pandemic response, Governor Little had a statewide approach, and there were some challenges to that, but also some positive things. At this point, we're seeing different level of activity throughout the state, and that is part of the reason the governor has turned it back over to the local decision-making authorities.
Jerry Rakow is the director of Eastern Idaho Public Health, where county representatives are drafting a COVID-19 response plan for the region.
It's a color-coded risk level, starting in green, which is the area in which we find ourselves now, the status that we are now. Progressing to a yellow level, and then orange, and then a red level, which would be critical and would require stay-home orders.
The plan details metrics that EIPH is monitoring. Those include hospital capacity and active COVID cases per 10,000 residents. If those numbers reach specific levels, it would kick the regional response into the next level of risk, triggering new mitigation strategies.
So part of the positive part of being able to have a local response is that we can target specific actions to specific areas if we have something that's happening that's isolated to a limited area.
Even where we currently fall in the minimal risk category, the plan does recommend basic social distancing as well as wearing masks where physical distancing is not possible. An order for mandatory face coverings in public would only occur if we reach the high risk level, the third level outlined in the plan. Rakow says cooperation with current recommendations should help us avoid restrictions or further economic impact in the future.
Our motto is prevent, promote, and protect, and that's what we're trying to do. Prevent illness, protect people's health. So for us, it has been frustrating that it has become a political issue. We are trying to do our very best to give people recommendations that we've been doing all along, to do those things that they can protect their health and help prevent the spread of a communicable disease.
We, the public, now have until Tuesday to review that plan and submit comments before the health board will then take a vote on a finalized version. Reporting in Idaho Falls, I'm Andrew Howe.